All right, strap in, everyone, because today we're going deep on thyroidectomies.
That's right, thyroidectomies.
And let me tell you, you might be surprised by what we uncover.
Definitely might be.
So, you're interested in learning more about the surgery?
Hmm.
And we've got some seriously in-depth medical texts to guide us. They get into all the nitty-gritty.
I mean, they really do.
But don't worry, we'll break it all down, make it clear, no medical degree required.
Yeah, absolutely. We're here to make it make
So
sense.
by the end of this deep dive, you'll be walking around like you're a thyroidectomy pro.
That's the goal.
Okay, so first things first, why would anyone even need a thyroidectomy? I always thought it was just a cancer thing.
Yeah, a lot of people think that.
But our sources, they list a whole bunch of other reasons.
Mm.
What else is going on?
Right, it's not just cancer. Thyroidectomy can be the answer for, like, a whole range of thyroid issues. Like, sometimes you've got these nodules, and they just won't quit.
Oh, stubborn nodules.
Yeah, exactly. Or sometimes your thyroid's just working way too hard.
Oh, yeah.
Hyperthyroidism.
Oh, good.
Causing all sorts of problems. And then, of course, there's goiters.
Goiters, what's that?
Basically just means your thyroid gland's gotten too big.
Okay, enlarged thyroid.
Yeah, enlarged thyroid, that's it.
But you did mention cancer. So when I ask cancer-related, what are we talking about specifically?
Well, the most common type is papillary thyroid cancer.
Okay.
And, good news is usually it's treatable.
Okay, good news.
But there are other types.
Oh, there are.
Yeah, follicular thyroid cancer,
Okay.
medullary,
Mm-hmm.
and anaplastic. And each of those, well, they have their own kind of quirks.
Ah, I see.
And some are more serious than
So
others.
it really runs the gamut then.
It does. It does.
Wow, okay, so, it sounds like deciding to have a thyroidectomy, that's a big deal.
Huge decision, definitely.
Not something you just jump into, right?
No, not at all. It's always a team effort. You've got the doctor, they're laying out all the options, explaining the risks, the benefits, all that.
Mm-hmm.
And then you've got the patient, and they bring their own concerns to the table, their preferences.
Right, because everyone's different.
Exactly. So together, doctor and patient, they figure out the best path forward.
It's a partnership.
That's it.
That makes a lot of sense. Okay, so let's say a thyroidectomy is the path you choose. What happens next? Like, what's involved in getting ready for this surgery?
Well, there's more to it than just, fasting the night before. It's about making sure you're in tip-top shape, minimizing those risks as much as possible.
Give me an example.
Okay, so let's say you have hyperthyroidism. Your thyroid's like in overdrive.
Oh, yeah.
Now, if that's not under control before surgery, you could be at risk for this thing called thyroid storm.
Thyroid storm, that sounds intense.
Yeah, it's basically like a surge of hormones. It can be dangerous.
Oh, wow.
But thankfully, it's preventable with the right meds.
Okay, that's good to know. What else happens in that pre-op phase?
Well, the doctors, they want a clear picture of what they're dealing with.
Sure, yeah.
So ultrasound imaging, that's a must.
Okay.
It helps them pinpoint the exact issue, like a roadmap for the surgery.
Gotcha.
And sometimes they might also do a laryngoscopy.
Laryngoscopy, isn't that looking at your vocal cords?
Exactly.
Ah,
It's
yeah.
especially important if you've had surgeries in that neck area before, or if you have any, voice concerns.
Yeah.
So they check your vocal cords beforehand. That way, the surgeon can be extra careful during the procedure, helps protect your voice.
That makes sense. Our voices are pretty important.
They are.
And speaking of protecting the voice, I learned about something, kind of blew my mind, how they monitor the vocal cords during surgery.
Oh, yeah, the intraoperative neuromonitoring.
Say that again?
Intraoperative neuromonitoring, or IONM.
IONM. Okay, break that down for us.
So imagine like a GPS guiding the surgeon around all the delicate structures during the operation.
Oh, I like that analogy.
Right. So they place these electrodes, near your vocal cords,
Okay.
and it allows them to track the activity of the recurrent laryngeal nerve. That's the nerve that controls your vocal cords.
So it's like a real-time safety check for the surgeon.
Exactly. That's what it is.
That is incredible. Is that used in every single thyroidectomy?
It's a great tool,
Yeah.
especially in the complex cases, like cancer, or if someone's having a repeat thyroidectomy.
Mm-hmm.
But whether it should be used for absolutely everyone routinely, well, that's still being debated.
Really?
Yeah. Some experts, they feel very strongly it should be standard. Others say it's not always necessary.
So there's no clear consensus yet.
Not yet, no.
I can see both sides of that. Now, onto something I found really surprising. You don't always have to be completely knocked out for a thyroidectomy. Like, there are options with the anesthesia.
You're right. You've got general anesthesia.
Yeah.
You're completely asleep.
Yeah, the classic.
Right. But some patients can have a cervical block instead.
Cervical block, what's that like?
So basically, it's an injection that numbs the whole neck area. You're awake during the surgery, but you don't feel anything.
Wow, I bet that speeds up recovery.
It can, yeah.
So what determines who gets general versus cervical block?
It depends on a few things. Complexity of the surgery, the patient's overall health,
Makes sense.
and, of course, their preferences. Some folks are fine being awake. Others, they want to sleep through it all.
Yeah, I think I'd be team sleep through it.
Right.
But before we move on, can we talk about those little parathyroid glands?
Yeah, those tiny but mighty glands.
They're near the thyroid, right? Our sources say they're super important for calcium.
They are, oh my gosh, they're like little calcium powerhouses,
Yeah.
making sure your body has just the right amount.
So surgeons have to be really careful around those during a thyroidectomy.
Absolutely. They take great care to protect those glands.
Because if they get damaged...
That's when you can run into calcium problems later on. But here's where it gets really interesting, okay? If a parathyroid gland does get damaged during surgery,
Uh-oh.
they can actually try to reimplant it.
Wait, what? How do they do that?
So they take the damaged gland, mince it up into these tiny little pieces, and then they reimplant those pieces somewhere else in the neck.
That sounds like science fiction.
It does, right?
Yeah.
But it can actually work. The hope is that those little pieces, they'll take root and start working again.
Wow, that's incredible. So let's say the surgery's done. Parathyroids are hopefully happy in their new home. What happens next? Our source lays out what to expect during recovery.
Okay, yeah. Recovery after a thyroidectomy, it's all about making sure things are healing up nicely, getting your body back on track.
Okay, yeah, that makes sense. So what are the key things to know about post-op care?
Well, your thyroid, it plays a big role in hormone production, so you'll likely need to start taking thyroid hormone supplements.
To make up for what's missing.
Exactly. The most common one is levothyroxine, and it basically helps your body function as if it still had a thyroid.
Ah, so it's kind of like personalized hormone replacement then.
Yeah, that's a good way to put it.
Yeah.
And your doctor will keep an eye on your levels, make adjustments to the dosage, get it just right for you.
Okay, personalized medicine, I like it. What about those parathyroids we were talking about?
Right.
Anything special that needs to be done for them after surgery?
That's a great question. Because of parathyroids, they're so crucial for calcium balance. Your doctor might recommend calcium supplements,
Okay.
especially if there was, any concern about damage during the surgery. And they'll monitor your calcium levels really closely.
To make sure everything's in balance.
Exactly.
So, hormone levels, calcium levels, those are key.
Mm-hmm.
What else is important to know about recovering from a thyroidectomy?
Well, you're going to have some soreness,
Right.
some swelling in that neck area after surgery. That's totally normal.
Yeah, can imagine.
Your doctor will probably give you pain meds, help manage any discomfort.
Okay, good.
And in terms of getting back to your usual routine, most people can start easing back into things within a few weeks.
So no marathon running right after surgery, huh?
Probably not the best idea.
Probably not. Okay, so, you mentioned easing back into things. I imagine those follow-up appointments with the doctor, those are pretty important during recovery.
Oh, absolutely. Those checkups, they let your doctor really keep track of your progress.
Right.
Make sure your incision's healing well, answer any questions you might have.
Sure.
And they'll also keep monitoring those hormone and calcium levels we talked about.
Okay.
Adjust your meds if needed.
Got it.
So, it's all about making sure you're on that road to a smooth recovery.
It sounds like having that supportive medical team, that's really key throughout this whole process.
Oh, for sure.
Now, no one likes to dwell on the negative,
Right.
but our source material, it does mention potential complications after surgery.
Sure.
Is there anything we should be particularly aware of?
Of course, with any surgery, there are risks. Thyroidectomy, no exception.
Okay.
One thing to watch out for is something called a hematoma.
Hematoma. What is that?
Basically, it's a collection of blood that can form under the skin.
And that can be dangerous?
It can be if it's not addressed quickly.
Oh, okay.
So if you notice any unusual swelling or pain in your neck after surgery, call your doctor right away. That's crucial.
Okay, good to know. What about other potential complications?
Another one is nerve injury.
Okay.
This can happen when those nerves that control your vocal cords get accidentally damaged during surgery.
Yeah.
Now, thankfully, this is usually temporary,
Okay, good.
but in some cases, it can be permanent.
That must be a scary thought for people.
It is. And that's why surgeons are so careful to protect those nerves during the procedure.
Right. And that's where that IONM can come in handy.
Exactly, that GPS for the surgeon.
Right. Now, you mentioned temporary versus permanent nerve damage. Are there any signs someone should watch out for?
Definitely. If you have any hoarseness, any changes in your voice,
Hmm.
or difficulty breathing after surgery, let your doctor know right away.
Okay.
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 They can assess what's going on, determine if any intervention's needed.
So hoarseness, breathing problems, those are
Mhm.
red flags.
Yep.
Okay. So hematoma, nerve injury,
Mm-hmm.
two key things to watch out for. What about those calcium issues we talked about earlier?
Right.
Can they happen after surgery too?
Yes, they can. If the parathyroid glands were affected during surgery,
Right.
you might experience something called hypocalcemia.
Hypocalcemia, break that down for
It
us.
just means your calcium levels are too low.
Too low,
Sure.
okay.
And
And what are the signs of that?
one of the most common ones is a tingling sensation,
Okay.
often in the fingertips or around the mouth.
Oh, so those tingling lips, they really can mean something.
They can. If you experience that tingling or any other unusual symptoms,
Mm-hmm.
contact your doctor right away. They can check your calcium, prescribe supplements if needed, get things back in balance.
Get that calcium back up.
Mhm.
Okay, great. So we've talked about the possible downsides,
Mhm.
but let's shift gears and talk about something really exciting.
Okay.
Our source material, it dives into the world of minimally invasive thyroidectomy techniques.
Oh, yeah, that's fascinating stuff.
It's incredible how technology is changing the field of surgery.
Right. It really is.
Tell us more about these minimally invasive approaches.
Okay, so instead of that traditional open surgery
Mm-hmm.
with the bigger incision,
Yeah.
minimally invasive techniques, they use smaller incisions,
Mm-hmm.
specialized instruments, often with cameras.
So less cutting, more high-tech tools.
Exactly. And there are a couple of main approaches.
Okay.
You've got endoscopic thyroidectomy
Mm-hmm.
that uses a tiny camera
Mm.
called an endoscope
Right.
to guide the surgery.
Okay, and then the other approach?
The other one is robotic-assisted thyroidectomy.
Robotic surgery, that sounds straight out of a sci-fi
I
movie.
know, right? So cool.
So how does that work?
They use a robotic system
Hmm.
controlled by the surgeon
Okay.
to perform the procedure
Wow.
with even greater precision.
Okay, so what are the advantages of going less invasive?
Well, the biggest one, smaller scars.
Yeah, that's a big deal.
Huge deal for a lot of people, especially if the incision is in a visible area like the neck.
Right, right. Any other benefits?
Often, less pain
Okay.
and a faster recovery time.
Compared to traditional open surgery,
Exactly.
smaller scars, less pain, faster recovery, it all sounds pretty amazing.
It is pretty amazing.
But are there any downsides?
Of course, there are always trade-offs.
Right.
Minimally invasive techniques, they're not suitable for every patient, every situation.
Okay.
Sometimes, the size or the location of the problem, it makes open surgery necessary.
So it's not one size fits all.
Exactly. And it's important to note those minimally invasive procedures,
Mm-hmm.
sometimes they can actually take longer than traditional surgery
Oh, interesting. Why is that?
because they require more specialized equipment, higher level of technical skill.
So there's more to it behind the scenes.
Yeah, there is.
So it's all about weighing the pros and cons, finding the right approach for each individual.
That's it. And that's where that conversation with your surgeon is crucial.
Yeah.
They can help you understand the options, make the choice that's right for you.
Now, shifting gears a bit, one of the things that really struck me
Hmm.
while we were prepping for this deep dive
Yeah.
was just how complex the thyroid gland is.
Right.
It's this tiny little butterfly-shaped organ,
I know.
but it plays such a huge role in our overall health.
It does. It really
Yeah.
does. It's like the conductor of our body's orchestra,
Okay, I like that.
regulating our metabolism, our energy levels,
Hmm.
even our mood.
Wow. And when it's not working properly.
Oh, then things can get out of whack.
So it's not just a lump in the neck like a lot of people think.
No, not at all.
It can manifest in all sorts of ways.
Yeah, it can. It can. And it's often those subtle, seemingly unrelated symptoms
Right.
that people kind of brush off or think it's something else entirely.
That makes sense. It just reinforces, how important it is to pay attention to our bodies
Mhm.
and speak up when something feels off.
Advocate for yourself. Yes, absolutely.
Now, let's talk about something that I think a lot of people listening might be wondering about.
Okay.
The emotional side of having a thyroidectomy.
Yeah,
It's not just a physical procedure.
right.
It can have a real impact on someone's mental and emotional well-being.
Absolutely. It's a major life event, and it's totally normal to have a whole mix of emotions.
Yeah.
Anxiety, fear, uncertainty, even grief.
Grief. Can you elaborate on that a little bit?
Sure, for some people, having a thyroidectomy, it can feel like a loss, even if it's a necessary one.
Right.
They might grieve the loss of their old self
Mm-hmm.
or worry about how the surgery will change their body image, their sense of identity.
That's a really important point to acknowledge.
It is.
So what are some ways people can cope with those difficult emotions?
Well, one of the most powerful things you can do is connect with others who've been through it.
Ah, yeah.
There are tons of online support groups and communities. People share their stories,
Okay.
offer advice, provide emotional support.
So finding that community, knowing you're not alone,
Exactly.
that can be incredibly helpful.
It can be a lifesaver, honestly.
I-
And don't underestimate the power of talking to loved ones, a therapist, a trusted healthcare professional, about what you're going through.
Right.
They can offer a listening ear, practical advice, and emotional support.
I think those are really valuable takeaways.
Mm-hmm.
Now, before we wrap up this part of our deep dive,
Okay.
I wanted to circle back to something we touched on earlier.
Yeah.
That debate about the routine use of intraoperative neuromonitoring, that IONM.
Right.
It's clearly valuable in high-risk cases, but what about using it for every single thyroidectomy?
That's the million-dollar question. There are strong arguments on both sides.
Break it down for us.
Okay, so those who are for routine IONM, they argue that it just provides an extra layer of safety, helps prevent even minor damage to the recurrent laryngeal nerve.
Right.
They say even temporary voice changes
Yeah.
can be incredibly distressing for patients.
Okay, so that side is all about minimizing risk, protecting the patient's voice.
Right.
What about the other side of the debate?
So those who are more cautious about routine IONM, they point to a few things.
Okay.
One, the cost. The technology can be expensive.
Makes sense.
They also worry about false positives, which could lead to unnecessary interventions during surgery.
Ah, I see.
And finally, they argue that experienced surgeons, with their knowledge of anatomy, their meticulous techniques, can successfully protect the nerve without relying on IONM.
So it's really a complex issue.
It is.
With valid points on both sides.
Definitely.
It's a decision that's best made on a case-by-case basis than...
Exactly. Taking into account the patient's individual situation, the surgeon's experience,
Right.
and of course the latest research findings.
And speaking of research,
Yeah.
what are scientists currently investigating in the world of thyroidectomies? What are the hot topics?
Well, one area of active research is all about refining those minimally invasive techniques,
Okay.
making them even safer and more effective.
Even better.
Yeah. They're exploring new instruments, imaging technologies, surgical approaches to really minimize scarring, reduce pain, shorten recovery times.
So it's all about pushing the boundaries,
Yeah.
improving that patient experience.
Exactly.
That's exciting. What else are they working on?
Another exciting area is personalized medicine. Trying to understand how individual genetic and biological factors influence treatment outcomes for thyroid conditions.
So like tailoring treatment plans to each person's unique makeup.
Precisely. The goal is to move away from that one-size-fits-all approach.
Right.
Develop more targeted and effective therapies based on an individual's specific needs.
That's fascinating. So it sounds like the future of thyroidectomy, it's going to be even more personalized, less invasive. But until then, what's the best advice for someone who's facing this surgery?
The most important thing, arm yourself with knowledge.
Okay.
Do your research. Ask questions. Have those open and honest conversations with your healthcare team.
Yeah.
They're your partners in this journey.
Right.
Together, you can make those informed decisions, take control of your health.
That's great advice. Now, before we wrap up this part of our deep dive, I wanted to go back to something we discussed earlier.
Yeah.
Those parathyroid glands and their crucial role in regulating calcium.
Right.
What exactly does calcium do in our bodies?
Calcium, it's a VIP in the body, let me tell you.
Okay, I'm all ears.
For starters, it's a major building block for strong bones and teeth.
Okay. Yeah, we all know that one.
Right. But it goes way beyond that. Oh, yeah, it's vital for muscle function, nerve transmission, blood clotting, even hormone regulation.
So it's involved in all sorts of things.
It is. It's kind of the big deal. So if someone's calcium levels are off, it can really throw things out of whack.
Okay, so too little calcium, that's hypocalcemia, right?
That's right.
What can happen?
Well, you can get muscle cramps, weakness, tingling, and even seizures in severe cases.
Oh, wow. That sounds pretty serious.
It can be.
What about too much calcium?
So that's hypercalcemia.
Hypercalcemia.
And that can cause a whole other set of problems.
Like what?
Fatigue, nausea, constipation, even kidney stones.
Okay, so calcium balance. Definitely something to pay attention to.
For sure.
Now, you mentioned the parathyroid glands. They're responsible for regulating calcium.
Yeah.
But how do they actually do that?
It's actually a pretty fascinating process.
Okay.
So when calcium levels in the blood get too low, the parathyroid glands release this hormone called parathyroid hormone, PTH.
PTH, got it.
And this PTH, it acts like a messenger, telling the body to release more calcium from the bones into the bloodstream.
So it's like a calcium reserve system.
Yeah, exactly. And when calcium levels get too high, the parathyroid glands get the message to, like, chill out, stop producing PTH.
Okay.
This lets the kidneys filter out the extra calcium, bring things back into balance.
Wow. It's amazing how our bodies just, like, know how to do that.
I know, right?
Keep everything running smoothly.
It is, and it shows how even those tiny glands, like the parathyroids, can have a huge impact on our health and well-being.
Now, we've covered a lot about the surgery itself, but I'm curious, what are some of the long-term considerations for someone who's had a thyroidectomy? Like, what are some things they might need to think about down the road?
Well, one key consideration is lifelong thyroid hormone replacement therapy.
Right. We talked about that earlier, but just to remind us, why is that necessary?
Because your thyroid gland, remember, it was making those essential hormones.
Right.
Removing it means your body can't make them on its own anymore.
Right.
So you have to take medication to replace those missing hormones.
Okay.
Keep your body running smoothly.
And that's something you need to do for the rest of your life?
In most cases, yes.
Okay.
But the good news is thyroid hormone replacement, it's very effective.
That's good.
Once your dosage is adjusted right, you should feel like yourself again.
That's reassuring to hear. What about other long-term considerations?
Another thing to be aware of is the possibility of changes in calcium levels.
Even if the parathyroid glands were fine during surgery?
Yes, even then, there's still a chance their function could be affected down the road.
So it's something to keep an eye on, even years after the surgery?
Exactly. It's important to have regular checkups.
Right.
Monitor your calcium levels, report any unusual symptoms, like tingling or muscle cramps.
Okay, so lifelong hormone replacement, potential calcium issues, those are two key things to be aware of. Anything else?
Another consideration, though it's less common, is the impact on fertility. Thyroid hormones, they play a role in reproductive health.
Right.
So having a thyroidectomy can sometimes affect fertility.
Interesting.
Especially in women.
So that's something people might not think about.
Right.
What can be done if someone is concerned about fertility after a thyroidectomy?
Well, it's important to talk openly with your doctor.
Okay.
And if needed, consult with a fertility specialist.
Okay.
They can assess your situation, discuss options for managing any potential challenges.
So again, that open communication with your medical team is key.
Absolutely.
Now, we've talked a lot about the medical side of thyroidectomy, but I'm curious about the psychological impact of living with a thyroid condition.
Sure.
Our sources mention that thyroid hormones, they actually play a role in mood regulation.
Yeah, it's fascinating, really. The thyroid gland is like a tiny little emotional influencer, impacting our moods and energy levels in these subtle ways.
So if someone's thyroid is out of whack, it can affect their mental well-being.
Absolutely. Yeah.
Okay, so how does that work? Like with hyperthyroidism, where the thyroid's overactive?
Okay, so with hyperthyroidism, it can lead to anxiety, irritability,
Right.
restlessness, even trouble sleeping.
Those sound a lot like the symptoms of like general anxiety.
They do, right?
Yeah.
And that's why getting the right diagnosis is so important.
Yeah.
Sometimes what looks like a mental health issue
Right.
might actually be rooted in a thyroid problem.
That's really interesting. Okay, so too much thyroid hormone can ramp up that anxiety.
It can.
What about too little hormone, hypothyroidism?
Right.
What's the impact on mood there?
Well, hypothyroidism, with its sluggishness, low energy,
Yeah.
it can often lead to feelings of depression, fatigue, difficulty concentrating.
So it's like a double whammy.
It is.
Physical fatigue, AMD, emotional fatigue.
Exactly.
Yeah.
And again, this highlights the importance of getting that proper diagnosis and treatment. Managing those thyroid hormone levels, it can have a huge impact on your well-being, both physically and emotionally.
Now, we're diving deep into thyroidectomies,
Hmm.
but are there other treatment options for thyroid problems?
Oh, absolutely. Surgery isn't always the first line of defense.
Okay.
It really depends on the specific condition, how severe it is.
What are some examples of non-surgical options?
Okay, so for hyperthyroidism, where the thyroid is overactive,
Mm-hmm.
medications like antithyroid drugs can help slow down that hormone production.
Okay.
Another option is radioactive iodine therapy, which targets and destroys those overactive thyroid cells.
Interesting. What about hypothyroidism, where the thyroid's underactive?
In those cases, the most common treatment is thyroid hormone replacement therapy.
Right. We talked about that earlier.
Yeah, the safe, effective way to restore those hormone levels, relieve symptoms.
So there's a whole toolbox of treatment options available.
There is.
Finding the right approach is all about, again, working closely with your doctor, understanding the pros and cons of each option.
Exactly. It's collaborative. Your doctor can guide you, help you make the best decision for you.
Now, we've talked a lot about the medical side,
Mhm.
but what about the practical side of things? Like, if someone's prepping for the surgery, what are some tips to make the whole experience smoother?
Great question. It's all about being proactive and organized.
Okay.
One of the most helpful things
Mm-hmm.
is gather as much info as you can about the procedure,
Okay.
the recovery process, what to expect.
So knowledge is power.
Exactly.
Mm-hmm.
Now, your doctor is always the best resource for personalized advice.
Right.
But you can also find good info from reputable sources like
Mhm.
the American Thyroid Association
Okay.
or the National Institutes of Health.
Got it. What about practical stuff at home?
Right. Well, make sure you've got comfortable pillows and blankets set up in a relaxing area where you can rest.
Makes sense.
Stock up on easy-to-prepare meals and snacks.
Okay. Good tip.
And if you have stairs in your home, think about setting up a temporary sleeping area on the main floor.
Ah, yeah, to avoid the stairs.
Exactly.
Those are great tips. Anything else that can help that recovery go smoothly?
Don't be afraid to ask for help.
Oh.
Let your loved ones know what you need assistance with,
Mm-hmm.
whether it's running errands, preparing meals, or just company.
Right. Sometimes we feel like we have to do it all ourselves,
Hmm.
but accepting help
Yeah,
can make a world of difference.
it really can.
Now, before we wrap up this part of our deep dive, I wanted to go back to something you mentioned about the emotional impact of having a thyroidectomy.
Okay.
What are some ways people can take care of their mental health throughout this whole process?
Well, taking care of your mental health, it's just as important as taking care of your physical health.
Absolutely. So what are some strategies people can use?
One of the most effective ways to deal with stress and anxiety
Mm-hmm.
is practicing relaxation techniques,
Mm-hmm.
deep breathing exercises, meditation.
Okay. Yeah, those can be really calming.
They are. What about connecting with others? Is that helpful?
Absolutely.
Yeah, talking to friends, family,
Mm-hmm.
a therapist. It can provide emotional support, help you process your feelings.
Right.
And like we mentioned earlier, online support groups can be great too.
Yeah, finding your tribe, knowing you're not alone.
Exactly. It makes a huge difference.
It does.
And don't forget about self-care activities.
Us.
Do things you enjoy, spend time in nature, listen to music, read a book.
It's about finding those little moments of joy,
Hmm,
replenishment.
exactly.
Now, before we wrap up this part of our deep dive,
Okay.
I wanted to ask you about something that's been on my mind.
Yeah.
We've talked about the risks and benefits of different surgical techniques,
Right.
but what factors go into choosing the right surgeon for a thyroidectomy?
Oh, that's such an important question. Finding the right surgeon, it can make all the difference in your experience and the outcomes.
So what are some key qualifications to look for?
Okay, first and foremost,
Mm-hmm.
look for a surgeon who's board certified in head and neck surgery
Okay,
or endocrine surgery.
got it.
This certification, it shows they have specialized training, expertise in thyroid procedures.
So board certification, that's a must.
Definitely. What about experience?
Yeah, how much experience should a surgeon have?
Experience is definitely important, especially with complex cases
Right.
or minimally invasive techniques.
Mm.
Ask the surgeon how many thyroidectomies they've performed, what their success rates are.
So don't be afraid to ask those tough questions.
No, absolutely not. You're trusting this surgeon with your health.
Right.
You should feel confident in their abilities
Mm-hmm.
and beyond the technical expertise.
Yeah.
Think about things like their communication style, their
Okay.
bedside manner, their overall philosophy.
So finding someone you feel comfortable with, someone who listens to your concerns.
Exactly. It's a partnership. You want to be on the same page. Don't hesitate to schedule consultations with a few different surgeons before you decide.
Okay, shop around a little bit.
Yeah. It's your health. You deserve the best care.
Those are great tips. Now, before we wrap up this part of our deep dive,
Mm-hmm.
I wanted to touch on something we haven't talked about yet.
Okay.
The role of diet and nutrition after a thyroidectomy.
Ah, yes.
Are there any specific dietary recommendations for people who've had this surgery?
That's a good question. There isn't like a one-size-fits-all thyroidectomy diet,
Right.
but there are some general guidelines that can help your recovery, your overall health.
Okay, give us the highlights.
One important thing is getting enough iodine.
Okay, iodine. Okay.
Yeah, it's essential for thyroid hormone production.
Right.
So making sure you're getting enough through your diet or supplements, it can really help your body adjust after surgery.
What are some good sources of iodine?
Seafood's a good one, dairy products,
Oh.
and, iodized salt.
Okay, so those are good things to keep in mind. But I imagine too much iodine isn't good either.
That's right. Too much can actually be harmful. So talk to your doctor
Right.
about the right amount for you.
So iodine's important. What else should people be thinking about?
Another key nutrient is selenium.
Selenium, okay. What does that do?
Well, selenium, it helps convert those thyroid hormones into their active forms.
Okay,
So it's super important for maintaining proper thyroid function.
gotcha. What are some good sources of selenium?
Brazil nuts are a fantastic source.
Brazil, okay.
You can also find it in seafood, meat, poultry, whole grains.
Okay, so iodine, selenium, those are two key nutrients to focus on.
Mm-hmm.
Any other dietary recommendations?
Generally, it's a good idea to just focus on a balanced diet.
Okay, yeah.
Plenty of fruits, vegetables, whole grains.
Right, the usual suspects.
Exactly. Those foods, they provide all sorts of nutrients that support your overall health and well-being.
Makes sense. So I guess the common sense healthy eating advice still applies here.
It does, it does.
Good to know. And I imagine staying hydrated is important too.
Oh, absolutely.
Sure.
Drink plenty of water. Water is essential for everything.
Right.
Transporting nutrients, regulating body temperature, you name it.
So water, good food, all important.
Yes.
Now, before we wrap up this part of our deep dive, I wanted to talk about something I know a lot of people worry about: scarring.
Sure.
We've talked about how minimally invasive techniques can minimize scarring.
Right.
But for those who have the traditional open surgery,
Mm-hmm.
are there any ways to reduce the appearance of those scars?
Yeah, that's a common concern. And thankfully, there are things you can do to help those scars heal nicely, become less noticeable over time.
Okay, I'm all ears. What are some of those scar minimizing strategies?
One of the most important things is to keep that incision clean and moist.
Okay.
Your doctor will probably recommend applying an antibiotic ointment or petroleum jelly to the area.
Okay. What about those special silicone scar sheets? Do those actually work?
They can be helpful. Those silicone sheets, they create a barrier over the scar,
Mm-hmm.
help regulate moisture, collagen production,
Right.
which can lead to a flatter, less noticeable scar.
So it's worth trying.
Definitely. And don't underestimate the power of massage.
Massage.
Yeah, once that incision's fully healed,
Mm-hmm.
gently massaging the area can help break down scar tissue, improve blood flow,
Okay.
which can really promote healing.
So keep it clean, keep it moist, silicone sheets, massage, anything else?
Sun protection is crucial.
Ah, yes, of course.
Sun exposure can darken scars, make them stand out more.
Yeah, makes sense.
So always use sunscreen on the area, even on cloudy days.
Good reminder. Okay, so sunscreen, massage, silicone sheets. Any other advice when it comes to scarring?
Just be patient.
Yeah,
Scar healing, it takes time, often several months, even a year.
right. It's a process.
So don't get discouraged if you don't see results right away.
That's a good reminder. Sometimes we expect these quick fixes, but healing takes time. It unfolds at its own pace. Now, before we wrap up this episode of The Deep Dive,
Okay.
I wanted to ask you, we've talked a lot about the physical stuff, but what about the emotional side of having a thyroidectomy? It's a big deal.
It is.
And it's got to have an impact on someone's mental and emotional well-being.
Absolutely. It's
Yeah.
important to, acknowledge that emotional side.
Yeah.
Give yourself permission to feel whatever comes up.
Yeah.
There's no right or wrong way to feel.
That's so important to remember.
It is.
What are some ways people can kind of cope with those emotional ups and downs?
One of the most helpful things is to talk about it
Okay.
with someone you trust,
Mm.
a friend, family member, therapist, support group.
Yeah.
Sharing your feelings, it can really lighten the load. provide a sense of connection and understanding.
So having that safe space to express yourself, that's crucial.
It is. And don't underestimate the power of self-care.
Ah, yes, self-care, always important.
Engage in things that bring you joy, whether it's spending time in nature, listening to music,
Yeah.
practicing mindfulness, pursuing a hobby.
Right, it's about finding those little moments of peace,
Yeah.
rejuvenation,
Exactly.
and finally,
Yeah.
be kind to yourself.
Oh, so important.
Healing takes time,
Mhm.
both physically and emotionally.
It does.
Allow yourself to rest, to grieve, to celebrate,
Mm-hmm.
to feel whatever comes up
Yeah,
without judgment.
that's it, without judgment.
That's such a beautiful message. It's a reminder that, self-compassion,
Mm.
that's essential throughout this whole journey.
It is.
Well, I think we've covered just about everything when it comes to thyroidectomies.
I think so.
We've explored the reasons for the surgery, the different techniques,
Mhm.
potential risks, complications,
Yeah.
recovery.
It's been a lot.
It has. But we've uncovered some fascinating facts, debunked some myths, and hopefully, left you feeling a little more knowledgeable and empowered.
Absolutely. Knowledge is power, especially when it comes to your health.
So keep asking questions, keep learning, and keep those conversations going with your healthcare team. They're your partners in well-being, and together you
Yeah.
can make those informed decisions that lead to a healthier, happier life.
Couldn't have said it better myself.
Thank-
Thanks for joining us on this deep dive.
Until next time.